The recording. Well, good evening, everybody, and welcome. This is our week 7 of Just One Thing for Health, premier project by Hippocrates Docs, where our mission is to help people who are curious about plant-based solution to the chronic disease epidemic, where our goal is to have 30 different doctors featured, and each one with a different challenge to help people shift lifestyle, because making changes in habits and lifestyle is daunting without support. So our mission is to bring information and support, and to support people from being curious about plant-based food as medicine right into being committed and changing their lifestyles and changing their health. So with that, this is week 7. And we have Dr. Rizwan Bukhari with us. He loves to have his friends call him Dr. Riz. He's a cardiovascular surgeon in Texas, and he has some wonderful information for us about eating more plants. His challenge is to have 2 servings of leafy plants, salads and such a day. So if we're not doing that yet, then that's the goal for this week. So with that, I'd like to welcome Dr. Riz. Thank you for joining us.
Well, thank you, Peter. It is an honor and a pleasure to be here. I'm excited about being included in this project, and I think it's a wonderful, wonderful thing you're doing. I think it's a great approach, too, when trying to change our habits rather than just doing a whole bunch of things at once. Identify a lot of good behaviors and institute them one at a time. And I really do like the way you're approaching this.
Well, thank you very much. And yes, thank you for being part of this. So can you tell us a little bit about your journey and how you've come to be plant-based? And obviously you're a cardiovascular surgeon, so it must be impacting your patients too to get them plant-based.
Yeah, you know, my journey is twofold. There's a personal journey and there's a professional journey. I am a vascular surgeon, which means I treat the blood vessels of the body everywhere except the heart. I do bypasses on the legs, and I do aortic bypasses. I will do carotid artery surgeries. I do angioplasties and stents. I finished my training back in the late 90s and have been in practice for about 20 years now, or a little over 20 years. And it's an interesting story. My professional journey and how this came about is that when I was in my training in the late 90s, it was becoming very clear what was causing atherosclerosis, or peripheral arterial disease. We had elucidated a lot of the risk factors and things like cholesterol and saturated fat and smoking. I actually said to myself, I thought, oh my goodness, I went into the wrong profession. People have figured this out. They're going to change their lifestyles, and I'm going to go out of business. And here I am 20 years later, and there's 3 times as much disease as there was then. And I can't keep up with it. I'm very busy. I'm grateful to be busy because I like my work. But at the same time, I began to become frustrated because although I was helping my patients I was patching them up. I call it plugging holes or putting out fires, but I wasn't helping my patients reverse their disease. And of course, don't get me wrong, it's very rewarding with what we're doing, but it's a concept that I think many of us in plant-based nutrition and medicine understand. We understand that the Western approach to medicine is to treat disease, but it is not preventing disease. And so that started my journey into trying to find ways to help my patients prevent the disease, or, you know, if I would fix their carotid artery or I would do a bypass on their leg for gangrene, I would want to try to help them change their lifestyle so that they wouldn't be back on my operating room table again. And that led me to plant-based nutrition and plant-based medicine. At the same time, there was this concurrent personal journey. And many of us are always trying to be healthier and live better. And I, like many others, had always thought I was doing it right. I would exercise, I would eat right. I used to eat lean meats, thinking that was the right thing. You know, many of us are that way. You know, I would be doing get my plenty of protein and balance the amount of fat and carbohydrates. And along the road, this journey involved my wife, Maya, who she and I are partners in the work that we do. We began to read about, you know, various authors who are pioneers in the field. We you know, read the China study, many of us know, and got introduced to the work of Michael Greger and Dean Ornish. And these things became very meaningful to me because as a physician and a scientist, as you and I spoke to earlier, there's data behind this. It's not just somebody making something up, but there's actually true good information that backs up that plant-based nutrition is the right way to go. For me specifically, it is the only way to reverse heart disease. And that was what was very important. My patients can be on every diabetes medicine, every hypertension medicine. They can be on statins. They can be taking 10 or 12 medicines, and they're not getting better. And yet, if you go on a plant-based diet, a whole food plant-based diet, you can reverse cardiovascular disease. And that was very meaningful to me. And also at the same time, kind of shocking. How come the world doesn't know about this, right? So that was my personal journey too, where how I got to I decided to, if I'm going to preach this to my patients, I'm going to live it. And so I went through a phase of my own, where like I said, I thought I was living a very clean life and exercising and eating right and staying lean. But I changed to a full-blown whole food plant-based diet. And at the same time, I began using this as a way to counsel my patients and what I call risk factor management as a part of their lifestyles. And we've taken it a step further in the sense that, as we were speaking earlier about lifestyle medicine, I believe that nutrition should be taken part in a bigger picture of how lifestyle should be approached. So that's does that get you a good little introduction on how I got to where I am?
Yes, wonderful. That's a great journey, and you know, being an example for your patients is probably the most powerful thing you can do for them. Being an example and helping them understand that, in fact, there is an alternative to the knife, and it is forks over knives, forks over surgical knives.
Yeah, and yeah, you could put it that way. Absolutely. Yeah.
Yes, and what a wonderful documentary and work that is. Took me a while to really understand that they were talking about the surgical knife, and that made so much sense.
Well, and I think I always thought it was a double entendre, you know, that it did have a double meaning. You know, the knife to cut the steak, but also the knife to be on the operating room table. You know? Right. And or at least even if that's not what they meant, that's what we can say, that we can teach our clients and our patients that.
Right.
I will say, you know, that I talked about my personal journey and with my patients, and then now we've taken it to wanting to be more involved in the community and take it even a larger scale. And that's why we appreciate the opportunity to be involved in projects like this, where we can reach an even larger audience. And that's important to us.
That's wonderful. And I'm so glad you're part of it. And the vision and the hope is to unite the voices of different doctors, and with the synergy, you know, the synergy of everybody working together, we can therefore have a more powerful voice. And that's my personal mission, and that's why I'm so honored to be able to work with people like yourself. What do you think are some of the things that it will take to actually get to the tipping point where this is common knowledge, where people will know that there is an alternative to surgery and there is prevention?
Well, you know, I believe that it's just that we have to keep spreading the awareness and doing the things that we're doing. Social media is having a tremendous impact, and we utilize it widely. And what I think is happening is people are beginning to understand that our society is not living a sustainable, the approach that we are is not sustainable. We're starting to get to things from an environmental standpoint, which we'll never be able to sustain. From a healthcare standpoint, which we will never be able to sustain. Me personally, I look at the cost of healthcare. When I give some of my talks, it's meaningful to the people in the audience that I show them that we spend trillions of dollars a year on healthcare, but our population is now sicker than ever. Yeah. And I point out to them that, look, we spend more money than ever, yet we're sicker than ever. Obviously, we're not doing the right thing. And now it's time to start thinking outside the box and say, well, how can we do something different? What is it? How can we look at it? And what is it can we do different? And so I think that from a healthcare standpoint, we need to help people understand also that prevention is important, and show them that they can live longer, healthier lives and not be where I am. It's a very interesting thing. I see it every day. I can ask my patients, the ones who are on the table, without trying to shock you, when I take off somebody's leg and I ask them, if I had told you 20 years ago you could have changed, knowing what you know today, would you have done something different? And all of them say yes. The hard part though is getting that message to them. But as far as you talk about the tipping point, I see a momentum occurring here. That it is clearly different today than it was 2 years ago.
Absolutely.
And I do believe then that it's kind of like the snowball that's rolling down the hill, and it's getting bigger, and eventually it's going to gather momentum and get bigger and bigger. And there's going to be a point where plant-based nutrition, a plant-based lifestyle, isn't just some kind of odd, quirky thing that a few people have heard of, but it's very much a part of the mainstream, and will be an accepted part of the mainstream. When that starts to happen, one of the largest driving forces in our universe, which is consumerism, will begin to also pay attention to it and cater to us. And I kind of see that also. Believe it or not, I see big business as having a part in the transition.
I applaud that, and certainly believe that consumerism, we do drive business. It's businesses on one hand are really, American businesses unfortunately are very focused on the short-term profit, but they also do respond. So when we're asking for more and we're asking louder, then they kind of hear us, and so yes, look forward to us driving so much of this, and the consumerism, like you say, is very powerful.
Yeah, I see it regularly now. There's when you go out, there's restaurants that normally wouldn't offer a plant-based option. Definitely, we may not have 1 million of them, but now we're starting to see places that at least offer 1 or 2 things. So it's on their minds that they have to offer that because there's a market for it. And I think we'll continue to see that. I think we'll see that in more and more places. There's entire segments of supermarkets that are now plant-based and catering to our needs. The restaurants will often offer dishes, not just a salad removing this, but a true option for us. And like I said, this is just the tip of the iceberg, or the beginning of the snowball.
Yes, that's wonderful. And the gluten-free and organic concepts have certainly proven that to be right. People are asking for gluten-free and organics, and we're starting to see more and more of it. Let me see. I think we have a couple questions here, and we're here to answer questions. One question is, how is your work viewed by other doctors in your hospital?
That's very interesting. And I think I'm probably no different than many physicians who are kind of on the leading edge in their institutions. they look at me with a little bit of a sideways glance. And but I have conversations every day. I work in a smaller hospital, and where we all know each other, and we have conversations at the physician's lounge around lunch and things, and all of them, without a doubt, understand and respect the ideas that we are discussing, and they get it. It's but at the same time, many of them are subject to the same cultural biases that all the rest of the American population is when they grew up. So it's very hard for them to think outside the box. But at the same time, when I have these conversations, you will be amazed. I'll be doing an operation, and I'm talking with the surgeon across the table from me, and the anesthesiologist is listening in. And the next day, the anesthesiologist says, "Hey, Dr. Riz, I went plant-based."
Nice.
And it's because they hear the conversations, it piques their interest, they do some research, and they join in. And this has happened not just a handful of times. I've become known as the plant-based doctor at the hospital, and when people want to talk about it, they come talk to me. I'm very proud of the fact that many of my colleagues that I work with, from surgical techs to nurses to anesthesiologists to other doctors, have paid heed to what I have to say and are finding some validity in it and making it a part of their lives.
Mm-hmm. Wonderful. That's really great to hear. That's beautiful.
And if I may, I mean, I have an agenda too, which is to continue this. Fortunately, I also have the ear of the administration, and I would like to continue to work with them to offer plant-based options. I'm a big believer in not slapping somebody in the face and expecting a good response. So I don't confront them in a negative manner. I want to work with them as and saying, hey, let's partner together to find a better way to offer things to our patients. So I do intend to work with my administrators and administration to begin to offer plant-based options. I think I'm very proud of California, the state of California, having just instituted the opportunity that plant-based options must be offered at hospitals. And I think that's a good precedent, and I think that's a good way to approach our physicians and our hospitals and get them to actually open their eyes and say, look, other places are doing it. Maybe it's something that we ought to look at as well.
Yes, that's awesome. Let me see. Another question here. What are some of the best options to find a whole foods plant-based lifestyle primary care physician in my area? So this is from Texas. Probably Gregory, where are you from? Where exactly are you? Could you type that in? He's wanting a primary care physician. That's an excellent question. Another question that came in was, what do I do if my primary care physician isn't on board?
Right. Those are great questions. And by the way, I didn't know, but I can see the chat now. So
okay,
I was relying on you to tell me the questions, but I see the chat now, so I'll be reading that as well.
Okay.
I'm as frustrated as our patients are, to some extent. I personally am trying to develop a network of like-minded physicians who I can send my patients to, because if I'm sitting here counseling my patients on plant-based nutrition, and I'm a strong believer in it, and I'm showing them and teaching them how this is going to change and revolutionize their lives, I don't want to send them to the doctor next door who then discounts it and doesn't pay attention to it. And so it is very important, and I think there are other projects which are working on getting to the doctors and teaching them and trying to get doctors on board. I personally am working with doctors and trying to get them to understand. I share information with them, buy them Dr. Greger's book, How Not to Die, and trying to get them on board. But from a patient standpoint, I can understand the frustration, because they might, oftentimes the patients know more than their doctors, because the doctors never got this training, and they're living inside their black box, and they're not willing to think outside of it. And then the patients go to them and the doctors discount what they're talking about. And that can be very frustrating. So now there are a couple of directories that exist that plant-based physicians can sign up for, and I'll tell you one's called plantbaseddocs.com, and the other one's called plantbaseddoctors.org. So I would encourage patients to go and look those up. Now, unfortunately, the sheer number of doctors across the country is not large, but I think these databases will grow. For example, there's very few here in Dallas right now. But as I reach out and I try to increase the community, I will be getting my friends, my colleagues to sign up and get on here so that patients can find them. And so it's and that's the best I can say right now. The other thing, though, is if patients are armed with good information and they take it to their doctors, they can show their doctors that this is what I'm doing, and can you help me and support me in this endeavor? It's a little tough for me to say, go fire your doctor if he's not on board. But at the same time, if your doctor's not open-minded enough to say, hey, I'm willing to work with you on this, it might be time to shop for a new doctor. But I don't like to encourage people just to drop their doctor at the drop of a hat. I would say that it has to be a really well thought out decision.
Excellent. Well, and I'd like to add another resource to that. I think I've noticed we now have the American College for Lifestyle Medicine, and I believe they have a directory on their site also.
Oh, okay. Yes, I'll have to look that up and add that to my list. Yeah.
Yes, wonderful. So yes, Dallas-Fort Worth is where this question was coming from. Would you know anybody in the Dallas-Fort Worth area that's a primary care physician that you like to work with?
The reality is there is nobody on these registries in the Dallas area. Okay, there is, I think, one physician about 40 miles away in a suburb, but no, there's nobody in the Dallas area. Yeah, I would, but go ahead and take. I'm not sure who that was. Did you say the name?
That was Gregory.
Yeah, Gregory. I would encourage you to go and look and see. There might be somebody there.
Excellent. Oh, somebody said that they were so looking forward to this conversation tonight, and how much they've been appreciating having you talk with us. So that's wonderful. So is blood pressure the best indicator of trouble in our arteries? Is a question that we got.
That's I don't think it's I think that indicators of troubles in our arteries there's multiple factors that we look at. Certainly hypertension or high blood pressure is something that is usually one of the early things that we encounter, and we're seeing it earlier and earlier than we used to. And so when someone does have high blood pressure, that is something to take very seriously, and take measures and all efforts to manage their blood pressure. And for me, the best way to manage it is to get rid of it. Okay. And there's often opportunities through a plant-based lifestyle to do so. But if your blood pressure doesn't completely normalize, then certainly you have to do the other things to do that. Interestingly enough, there's plant-based nutrition. There's many opportunities through that to lower your blood pressure. And then regular exercise is very important in helping lower your blood pressure as well.
So is a plant-based diet, and I think I know the answer to this, it can absolutely prevent strokes also.
Yeah, I guess the big picture is that I would like to say yes. If if you adopt a plant-based lifestyle from an early age, you're going to negate many of these things that later on in life lead to the things that cause stroke. And so absolutely, atherosclerosis, which is a thing I treat, which causes blockages of the carotid arteries, is one of the leading causes of stroke, and that you won't have that. Hypertension or high blood pressure is another leading cause of stroke, and if a plant-based lifestyle also will distinctly reduce your risk of that as well. So no doubt about it, a plant-based lifestyle tremendously reduces your risk. I'll point out a plant-based. How about diabetes, for example? Diabetes is an epidemic in our country today, and it is all because of our diet. And if we were to change our diet, 80% of the diabetes in our countries would go away. And diabetes then is also one of those precursor diseases that leads to damage to so many different organs in our body. Can you imagine if 80% of the people in this country who had diabetes got rid of it? They would get rid of 80% of the other diseases that it leads to. It's just a tremendous domino effect. And so this is where the whole plant-based nutrition and lifestyle as a source of prevention can be an amazing thing.
Absolutely. I have a question here about statins. Can you talk about all about statins, how powerful or how well they work or don't, and side effects? And
yeah, it's very interesting. I went to UT Southwestern Medical Center, and I was there just around the time that Brown and Goldstein were awarded the Nobel Prize for elucidating some of the mechanisms related to cholesterol metabolism and things like that. And statins, I was particularly interested in how statins developed over the course of the next couple of decades, and lots of them did. It's a very interesting thing that maybe the general population doesn't understand, that we're taking all these statins to reduce our cholesterol and our triglycerides, but it's really reducing them by a very small percentage. And hundreds of people have to take a statin in order for one or two people to show a really significant benefit. So these are epidemiologic numbers, study numbers, where you're talking about 1,000 people have to take this medication for a few to have a benefit. And so then the other hundreds don't see a benefit, okay, as far as its overall effect in their lifestyle. Whereas a plant-based lifestyle helps all of them. And then throw on top of it, for example, statins are some of the drugs that carry some of the highest side effects around. Throw on top of that how expensive they are. So you're taking an expensive drug that has a lot of side effects that benefits a few people. And so for me, although statins are, probably one of the largest selling things in the country as far as drugs are concerned, and largely touted, I don't see the benefit in them nearly as much as a plant-based lifestyle. And again, statins don't really truly reverse the buildup of plaque in your arteries, whereas plant-based nutrition does. And so plant-based nutrition doesn't have any bad side effects, and it will reverse the buildup of plaque. There's been only a couple of studies that show that there might be some plaque regression, plaque being the buildup of blockages in the arteries. There might be only a few studies that show the regression of plaque over decades of taking statins. So it's not a wonder drug like everyone thinks. Actually, to me, plant-based nutrition is the wonder drug.
Yes, absolutely. That really isn't so surprising for me, and I think anybody who's really been looking at plant-based solution, and with the placebo effect too. I suppose the placebo effect is part of when has reversed cardiovascular disease or has reduced cholesterol maybe as much as statin drugs have. Let me see if here we have some other questions. And we're joined here by Dr. Stănescu, who let's see if he has any questions for you. He himself is a physician and hopefully looking at coming on board with being plant-based. Dr. Stănescu, can you turn your microphone on? Do you have any questions that you'd like to ask? We can't hear you. Your microphone is off. Okay, you have a little microphone button at the bottom of your screen that you need to click on. It's still not on. Let's see. Can I control this? Oh, here, I can do this.
Can?
Okay, there you go. Speak up a little bit.
Can you hear me now? Can you hear
not quite well enough.
I can hear you barely.
Okay, hold on. Let me see if I can do something here. Hold on.
So,
can you hear me now? Can you hear me now better?
I can hear you.
Can you hear me?
I can hear you.
Okay. Well, I was wondering, like plant-based diet, how long basically the research shows they would work in limiting the plaque formation or regressing the plaque, even as it was hinted. What do you think? What will be the timeline?
And that's a good question. As I mentioned, like, for example, with statins, they studied these statins for decades before they started to see even just a minimal hint of regression. And these weren't even meaningful. Whereas with a plant-based approach, you're seeing clinical improvement in 18 to 24 months. Dr. Esselstyn's work showed when he took the sickest heart patients who weren't even eligible for an operation and who were basically doomed to death. Basically, they were like hospice patients. He put them on a very strict plant-based diet and saw clinical changes within weeks with decreased amount of angina and chest pain. And then over the course of just a few months, significant changes overall. And I think that there's something else that's interesting to look at is what I call biometrics, things that are measurable. And so you can look at cholesterol and you can look at triglyceride levels and see as an impact by starting a plant-based diet. And these numbers change just within a matter of weeks. Which is just absolutely amazing. You can put somebody on a statin, don't change their diet, and they might drop their cholesterol 10 points in 6 months. But you put somebody on a strict plant-based diet which eliminates cholesterol, and you'll see their cholesterol normalize in just a few weeks. So I think that we see that's the best way I can say we can measure some findings is either through biometrics or through some clinical findings. So a plant-based diet sees these changes quickly. I'll give you an example with diabetes. With diabetes in people who start on a plant-based diet, you can see their blood sugars drop tremendously within a couple of weeks. I've seen patients who are both on insulin and oral anti-diabetic medications get off of their insulin within 3 or 4 weeks. And I've seen other patients who are on both get off of all of their medications in 2 or 3 months. So these are amazing results, things that you don't see with medications.
I see. And apparently, with this plant-based diet, what would be the process? I mean, is there a gradual process where you just work people in gradually into the plant-based diet? Or because I understand if you jump into it suddenly into a drastic plant-based diet, it's pretty hard process. It's a pretty difficult process. It's not very acceptable by
Yeah.
people without major clinical problems. So the question is whether we can work out a system where we can gradually work people into it. I'm not sure if this has been studied or worked out.
Yeah, and I think that we have some of our pioneers in the fields who have their programs and how they approach it. We have people like Esselstyn who has programs, and Ornish or McDougall. These guys have defined programs on how to institute plant-based nutrition in your lifestyle. Personally, I think it really you have to tailor it to the individual, and there's some people who they say, okay, once they're believers and they know it, bam, they just snap their fingers and they do it overnight. That's, I call it the cold turkey effect. And if that's the personality and that's what works for them, then there's nothing wrong with that. On the other hand, I personally, when I made the choice and the decision, I transitioned over time, and that's what I felt like worked best for me. Maya and I, we have opportunities for transitioning people, and they can. These things, though, allow you to transition at your own pace. It might be that the ideas that we present to them, they can take them and do them over the course of 3 weeks or 4 weeks or 2 months, or they might do them over the course of 6 months. It depends on what fits their abilities. For example, I'll give you an idea what we do with some meals. For example, we'll tell people, take 3 meals that you already have within your staple of diet, and that are already plant-based, and focus on those, and then add 3 more meals that were not, and but that you'll like, and add those in. So now you've added some meals, and now you have a basis of meals that you like, and now start eliminating some meals from your plan that you know are not plant-based and are not good for you. Now, someone might be able to do that in the first week or 2 weeks, or somebody else might want to take a month to do that. So once again, basically, that's a long way to say we help people transition at their own speed.
I see. That makes more sense, because everybody's different, right? And to change the taste overnight is not something very, very easy, unless there is a dramatic clinical problem. I mean, like you put it, coronary artery disease, or even poorly controlled and out of control diabetic neuropathies, or it has to be something really dramatic happening in their, or rather end-stage disease, in order for them to make such a drastic change in their diet. So it has to be a transition. I prefer to learn more about a transition process that's more individualized. That makes more sense to me.
Yeah, I will tell you that Dr. Esselstyn's work was a very, cut and dry, very quick transition.
I understand, but he was working. I'm sorry to interrupt. He was working with end-stage heart failure, with people in end-stage diseases, almost, as you put it, almost hospice cases. He was working with a different set of patients. I'm working with patients that, are relatively healthy, but have some problems. Have a cholesterol problem, have a diabetes problem that's not very well controlled. It's had some history of coronary disease that's been taken care of. It's very hard to get a person that is stable to transition very fast. So it has to be a process. It's really a process, both at the psychological level and lifestyle change level, mostly a lifestyle change level. I mean, the taste level, you know, and it's not easy. But with psychological support and diet support and counseling support, I think they can make the transition and make the change. But it's an effort which is absolutely worth doing. But I'm interested in a process. If anybody has experience with the process, apparently you personally have experience with the process, and that's wonderful.
Yes, yes. So, you know, and I agree with you about that. Yeah, I think that, again, that what I was getting at is that exactly that for Esselstyn, it was like he was approaching it with the surgical precision of operating, but he was operating with plant-based medicine. He took those patients and immediately transitioned them to a plant-based diet because he had to in order to reverse their things. Whereas in other cases, you know, people can transition at different speeds. I see a question here from Abraham, and he says, how helpful will be an enzyme supplement as Vitalzyme in unclogging of arteries in conjunction with plant-based plan as Dr. Esselstyn's? And I'll tell you, I'm a big believer in not needing supplements. I believe that if you use a well-rounded plant-based, whole food plant-based diet, supplements become unnecessary. And also, my thought and approach on supplements is that they are isolated. They're kind of almost the exact opposite of what we're promoting, which is the whole food. When, for example, I'll just give you as an example, apple versus apple juice. An apple is loaded with fiber, phytonutrients, antioxidants, and as well as the sweetness and the sugars of an apple. Whereas apple juice has been stripped of all of those things and is just sugar and water. I agree. And so similarly, you know, so when you take an apple, you're kind of getting the whole goodness. When you're getting apple juice, you're not. You're getting kind of a stripped down, refined, processed version. Similarly with supplements, you might be getting some one thing, but you're not getting it in the whole where you would with foods and kind of how the foods were made and how they helped us from the beginning. So that's my kind of feeling on supplements, and I don't believe that they're necessary. I hope that answers your question, Abraham.
Well, what else? Right, and somebody's saying that, you know, vitamins B12, there's a couple things that we really need to do if we're plant-based, that just a couple things that aren't included naturally in our plant-based foods. You want to talk for a second about that, Dr. Rez?
Sure. So of course, one of the big ones is vitamin B12. And I think that's actually, I like to explain it as that's a consequence of our modern world. A few hundred years ago, the way we ate, B12 got into our bodies in the water we drank and in the foods we ate because it was on the foods we ate. Whereas today, the fruits and vegetables we buy are clean and our water supply is so clean that the B12 is no longer there, which was a source for it. So we have to supplement. Even the B12 that people get from eating meat, I consider meat just as a conveyor of the B12. It's not really made in the meat. It's actually consumed by the animals and then passed on to us. And they're just a third party that's passing it on to us if we eat meat. So that's my belief on B12. So sure, we do need to supplement, but that's only because it's a consequence of our modern, actually just hyper clean, hygienic processes. Does that make sense?
Yes, excellent. Trying to go through these questions, see what else we might have here. Well, are there any other questions? I think we're coming to the top of our hour here, and If anybody else has any other questions they'd like to ask, we can address those. Otherwise, Dr. Riz, you have some parting words, some encouragement that you would like to share with us?
So I did see somebody just ask about vitamin D12. I think that's vitamin D. That's another thing that does come up. I think you'll find that the jury is out on that. Plant-based experts, some believe you need it, some believe you don't need it. My feeling on that is that it can be monitored. And if your D levels are low, you can certainly supplement them if needed. But I personally don't know. I don't have a strong opinion on that because I think there's a lot of split thought on it. Even personally, I don't know that there's even any consistency in the symptoms and feelings and things that people with low D levels have. I've known plenty of people who say, "Oh yeah, my vitamin D's low," but they're not having any problems and symptoms from it. And then they'll supplement, and then and nothing's different for them. So I think that would probably, from a vitamin D standpoint, I think that's more of a personal choice.
Okay.
Let me see if there's anything else here. I want to go ahead and address this. It's kind of funny. It brings a smile to my face. Abraham asks, one issue with plant-based is needing to go to the bathroom too frequently. Is that normal? And I think actually that's a beautiful side effect of a plant-based diet. The reality is 97% of Americans don't get enough fiber in their diet and don't go to the bathroom as much as they're supposed to. And that's a whole nother topic. And the reason we have such high colon cancer rates in America is because we don't get enough fiber. But fiber, which causes us to go to the bathroom more often, is so essential in managing so many things. It makes us irregular. It binds cholesterol. It makes sugar absorption normal and even. It helps the gut microbiome and bacteria that we have. So there's a tremendous amount of benefit of getting more fiber in our diet, and therefore going to the bathroom more, which is a quote side effect of the plant-based diet, is actually a good thing. So yeah, I did want to address that. I'm trying to see if there's anything else. And no, I think I've gotten all the questions that I can get to. I'd like to say thank you very much for having me. I love what we're doing here with the Just One Thing. I think it's an amazing way to every week introduce a new topic in plant-based nutrition to add to your lifestyle. What an amazing concept that over the course of half a year, you can introduce 30 meaningful things, and by the time 6 months have gone by, you can have revolutionized and changed your world completely.
That's absolutely, and thank you for that. And Dr. Stănescu, we'd love to see you recommend to your patients that they sign up for this program, and so they can start shifting their lifestyle. And hopefully in the future, we'll be able to help build some networks of other supports. Certainly, certified plant-based nutritional coaches are very important. People who can help hands-on and cooking classes and help people actually get the really wonderful, tasty meals that plants will offer. That's a whole nother conversation about the beliefs in our culture, where so many people believe they have to be eating meat and especially lots of oil to get tasty food. Oh,
I'll tell you, I just made a wonderful Indian dish that my mom, that I grew up eating my mom's, and I just wanted to keep eating it. I put it down so much, so we can make good foods and tasty and use other spices other than salt. And, I think that there's plenty of opportunities out there. There's something else I just thought about. And I wanted to mention, and I might have to ask my wife Maya to help me out here, but I wanted to mention Dr. Saray Stancic, and she is one of our thought leaders in the field. I'm sure many of you have heard of her, and she's coming out with a documentary called Code Blue. And that is meaningful for me because I think it's going to be an attempt to begin to bring physicians into the fold. And I'm looking forward to that because unfortunately, physicians don't know much about nutrition, and those of us like me are self-taught, but yet our patients and our population look to physicians as leaders and look to them for advice and validation of the way we live our lives. And so I'm hoping that the work that she does will help bring more physicians into the fold and help educate them and continue this revolution that we're seeing about that you and I talked about at the beginning.
Excellent. Well, with that, unless is there anything else you'd like to add? Does anybody else have a question they haven't asked that they need to have answered? And actually, if you have any other questions, please email them to me, peterg@hippocratesdocs.com, and I'll make sure to forward that. Why don't you tell us a little bit about, Dr. Riz, why don't you tell us a little bit about how people may be able to reach you and find your practice? And
Sure. So we try to use social media. We love the opportunities for communicating with the rest of the world out there. So I have a YouTube channel, which we are working on and continuing to develop, Dr. Riz Bukhari. I have an IG, which is Dr. Riz Bukhari. Maya, my wife, has an IG, which is plant-based DFW. And we do different things through those IGs. Mine is more medically and scientifically based, and hers is more about the support aspect, which is very important. And that's why, we talk about transition and different things like that. I'm sure I'm gonna miss something. We also have a website called Plant-Based DFW, which is, it's a pseudo-finished product, but will always be something in transition, but it has a lot of information, recipes, stuff about transitions. So I would encourage you guys to, and we also have a meetup here in the Dallas-Fort Worth area, where we will try to connect with other people, either review movies, look at books, talk about how to shop, and we're using that as our way of community support and supporting each other. I think it's very important when you're doing this is to have people and surround yourself with people who are like-minded so you can help each other. So I think those are our social media contacts. If you contact us, we'd love to hear from you. We'd love for you to sign up and participate. And it's a great way to communicate and ask questions.
Absolutely. Well, thank you so very much, Dr. Riz and Maya and everybody else who's joined us. Look forward to next week. We'll have our weekly email go out on Saturday morning with a special challenge, giving people a few days to tackle the challenge and build it into their lifestyle, and then come back Tuesday night and ask questions and get the support we all need to change the lifestyle. I believe our topic next week is going to be about oil, and oil is such a significant part of what's behind so much of the disease. So oil creeps in through lots of food, and we eat way too much oil. So please join us next week. And if you haven't signed up for the series, you can go to justonethingforhealth.com and sign up for the free subscription and get a chance to keep following Dr. Riz and our other wonderful 29 doctors as they come up with the just one thing at a time to change our lifestyle and our health. So thank you, everybody, very much, and have a great evening.
Thank you. Good night.
Good night.